This topic is urge incontinence. Urge incontinence, or overactive bladder, is random bladder muscle contractions caused by central nervous system dysfunction or spinal cord injury. Here, the signals being sent to the bladder are impaired, resulting in spasticity and hyperactivity of the muscle. Bladder disorders such as interstitial cystitis and bladder tumors can also cause urge incontinence. And finally, bladder outlet obstructions can cause urge incontinence. An example of this would be an enlarged prostate. In the enlarged prostate, urine is not able to get out of the bladder. In turn, the bladder is going to contract with more force and over time grow and strengthen the muscle. As we can see in the image here, the musculature of the bladder is going to be very hyperactive with urge incontinence. Because of this hyperactivity, clients are going to feel the need to very suddenly go to the bathroom, and they're not going to be able to make it in time, resulting in incontinence. As I said, in urge incontinence, clients are going to have a strong and sudden urge to urinate that's going to result in urine leakage. Now, depending on how full the bladder is and how strong that contraction is, the amount of leakage is going to vary. Urge incontinence is going to be especially common at night, and many of these clients are going to report waking up numerous times throughout the night and having disturbed sleep. Remember that urge incontinence can be caused by spasticity of the bladder, so we want to help clients retrain their bladder and learn urge suppression. If clients can learn relaxation techniques, they can help relax the muscles and prevent excessive contraction. Bladder irritants like smoking, caffeine, and alcohol are only going to increase the urge to urinate, so they should be avoided. Clients should also avoid constipation. Remember that the rectum is in pretty close proximity to the bladder, and if it's full, it's going to press on the bladder and result in incontinence. For clients with urge incontinence, we want them to empty their bladder before the urge happens, so we want to encourage them to empty the bladder every 2 hours while awake. This generally needs to be on a pretty strict schedule. As I mentioned, strengthening the pelvic floor is very important. Kegel exercises are going to help strengthen the pelvic floor. If clients are obese or overweight, weight loss needs to be encouraged. Increased adipose tissue is going to increase abdominal pressure on the bladder and can cause worsened incontinence. For clients experiencing bladder leakage or incontinence, we want to have them use absorbent products to help wick the moisture away from the skin. This could be a disposable pad or brief, but very important, clients need to change these regularly to keep the skin dry and prevent skin breakdown. Finally, antispasmodic medications such as oxybutynin and tolterodine can help reduce bladder spasms. These anticholinergic medications are going to prevent acetylcholine from binding at the receptor sites in the bladder. These anticholinergic medications are going to prevent acetylcholine from binding at the receptor sites in the bladder and relax smooth muscle in the bladder.